You know, I rarely start a video with a warning, but today I have two, because this one isn't just another tip or myth to debunk. It's something I've seen over and over again in my clinic, especially among older men who thought they were doing everything right. They exercised, they ate well, they took their vitamins, but still ended up struggling with prostate problems that slowly stole their comfort, their confidence, and their sleep. And after years of research and real-life cases, I can tell you it often comes down to one everyday habit that almost no one realizes is damaging their prostate. It's simple, it's common, and if you fix it, you could not only shrink your prostate naturally, but also protect yourself from a lifetime of unnecessary discomfort. So, before you assume it's too late, stay with me, because what I'm about to share could literally change how your body feels over the next few weeks. Let me start by asking you something personal. Have you ever woken up at night to use the bathroom once, twice, maybe even 3 or 4 times? Do you sometimes feel like you can't completely empty your bladder? Or maybe you notice the stream is weaker than it used to be. These are some of the earliest signs of prostate enlargement. And for millions of men over 50, they become a daily struggle. The surprising part? It's not always your age that causes it. It's the way your lifestyle quietly puts pressure on your prostate every single day. And the biggest culprit, something I see in 8 out of 10 patients, is how and when they sit. That's right. Sitting too long, sitting the wrong way, and doing it day after day slowly compresses your prostate and restricts blood flow to that area. Over time, it leads to inflammation, swelling, and eventually an enlarged prostate. I know what you're thinking, Sid. Really? Well, let me explain. Your prostate is a small gland, about the size of a walnut, sitting just below your bladder. It's responsible for producing part of the fluid that carries sperm. But here's the key because of where it's located. When you sit for long periods, especially on firm chairs or car seats, you're putting direct pressure on the area between your anus and scrotum, right, where the prostate sits. That constant compression reduces circulation, oxygen, and lymphatic flow. Imagine pinching a garden hose. The water can't flow properly. That's what happens to your prostate when you sit too much. It becomes congested, inflamed, and over time, enlarged. I once had a patient, let's call him Robert, 67 years old. He worked as a retired accountant who spent most of his days sitting in front of the TV or reading. He started waking up 5 times a night, feeling pressure in his lower abdomen and constant urgency. He thought it was just age. But when we dug deeper, I discovered his blood flow around the pelvic area was severely restricted. I asked him to make one change every hour: stand up, walk for 2 minutes, and stretch his hips. Within just a few weeks, he noticed fewer bathroom trips and a stronger stream. It wasn't a miracle, it was biology finally doing its job again. Once we stopped suffocating the prostate, and here's where it gets more interesting, it's not just sitting itself, it's how you sit. Many men cross their legs or lean forward for long periods. That compresses the pelvic floor muscles, which are directly connected to the prostate. When those muscles tighten for too long, they trap inflammation and fluids. And since the prostate doesn't have much space to expand, it swells internally, causing that uncomfortable pressure you feel when you try to urinate. But when you correct your posture, when you sit upright with your feet flat on the floor and take frequent standing breaks, you release that tension. Blood flow returns, oxygen reaches the tissues, and inflammation starts to drop. It's one of the simplest and most natural ways to improve prostate health without medication. Now, before we go further, I want to make something clear. There's no shame in having prostate issues. Nearly 50% of men over 50 have some form of benign prostate enlargement. But what bothers me is how preventable most cases are. Because while everyone focuses on medications, few people talk about these small lifestyle corrections that could have avoided the problem in the first place. And sitting is just one part of the story. The second hidden habit that worsens prostate health is dehydration. I can't tell you how many older men I meet who deliberately avoid drinking water because they're afraid of frequent bathroom trips. They think less water equals less urination. But here's the irony. When you don't drink enough water, your urine becomes more concentrated, more acidic, and it irritates the bladder and prostate lining. That irritation triggers inflammation, and the prostate swells even more. So, by drinking less, you're actually making things worse. I remember another patient, James, 71, who told me proudly that he only drank 1 or 2 glasses of water a day. He said, "Doc, I'm just trying to keep bathroom breaks under control." But his urine was dark, and he complained of burning sensations and constant pressure. I explained that the prostate and bladder need hydration to stay healthy. Think of your urinary system like plumbing. If you don't flush it regularly, sediment builds up. The same happens in your body. Once James started drinking 6 to 8 glasses of water a day slowly, throughout the day his irritation subsided, and his urgency reduced within 2 weeks. His body didn't need medication, it just needed balance. But there's another common behavior that quietly damages the prostate, and it's something many men over 50 develop without realizing: holding urine for too long. How often do you delay going to the bathroom because you're busy driving or watching something? Every time you do that, you're forcing your bladder to overfill and push harder against your prostate. That constant pressure weakens both the bladder and the surrounding muscles. Over time, it can make urination difficult and even cause dribbling or incomplete emptying. It's one of the most overlooked habits that slowly enlarges the prostate. Your body was designed to eliminate waste. Regularly ignoring that signal stresses the system. Let's talk about another factor: diet. We know fried foods, red meat, and processed snacks cause inflammation throughout the body, but few realize they directly affect the prostate too. Saturated fats and refined sugars increase estrogen levels and inflammatory markers, both of which can enlarge the prostate. On the other hand, diets rich in antioxidants, like tomatoes, berries, and green tea, have a protective effect. One compound in particular, lycopene from tomatoes, has been shown to reduce prostate inflammation and even slow growth. When men include more of these foods and cut back on heavy fats, their symptoms often improve within weeks. It's not magic hits, your cells finally being able to heal once you remove what's irritating them now. I want to bring your attention back to the core of today's message: sitting too long. The modern lifestyle has made it worse. We sit while driving, we sit to work, we sit to eat, and we sit to rest. That's 10 to 12 hours of sitting daily for many men. No wonder prostate issues are skyrocketing. But the good news is, even small breaks make a huge difference. Standing up every 45 minutes, walking around, doing a few gentle hip rotations, it all helps restore circulation to the pelvic region. Some men even find relief using a cushioned seat with a cutout in the center to reduce pressure on the perineum. It's a small investment that can prevent years of discomfort. Let's take a moment to think about the signs your prostate is trying to give you. Waking up multiple times at night, urine starting and stopping, burning sensation, lower back or pelvic pain. These aren't random, they're your body's way of saying something's off. And if you're ignoring these early warnings, the inflammation could silently grow until it becomes chronic. The key is not to wait for it to get worse. Start making small changes now. Stretch daily. Stay hydrated. Avoid sitting for hours without movement. Your prostate will thank you. Now, here's something most people never hear from their doctors: the connection between stress and prostate inflammation. When you're stressed, your body releases cortisol and adrenaline, which tighten your pelvic muscles and reduce circulation. This creates a perfect storm-restricted blood flow and chronic tension around the prostate. Many men notice their symptoms get worse during stressful weeks. That's why relaxation techniques like deep breathing, meditation, or even gentle yoga aren't just good for your mind, they directly help your prostate relax. When your nervous system calms, your blood vessels open, and your body can heal. I once worked with a man named Alan, 65, a retired police officer who'd been dealing with prostate discomfort for years. He'd tried medication, supplements, and even procedures. But what finally brought him relief wasn't another pill, it was walking. Simple 20-minute walks twice a day. Within a month, his nighttime trips dropped from 4 to 1. His wife told me he was sleeping through the night for the first time in years. That's the power of movement. The body is meant to circulate, to stay active. And when you bring back that rhythm, inflammation begins to fade naturally. And here's another truth that often surprises. People constipation can worsen prostate symptoms. When the colon is full, it pushes against the prostate and bladder, causing irritation. Many older men suffer from mild constipation due to low fiber intake or dehydration, and they never connect the dots. By adding more fiber fruits, vegetables, oats, flax seeds, and keeping your bowels regular, you remove that extra pressure. You can't heal the prostate without taking care of your gut. They're connected more than most people realize. Let's talk briefly about temperature. If you frequently sit on cold surfaces or are exposed to cold environments, it can trigger pelvic congestion. That's why traditional health advice often warned men to keep that area warm. Cold causes blood vessels to constrict, reducing flow and oxygenation. So, if you live in a colder climate, dress warmly and avoid sitting on cold metal or stone benches. It may sound simple, but those small details can make a world of difference in long-term prostate comfort. Now, let's come back to the bigger picture. Most men don't notice how daily habits accumulate. A few hours of sitting here, a skipped glass of water there, too much processed food over time, it builds up. But just as the damage accumulates slowly, the healing can begin slowly too, one good choice at a time. When you stand more, move more, eat cleaner, and manage stress, the prostate begins to decompress. Inflammation lowers, the gland shrinks, and your symptoms ease. I've seen it happen too many times to call it coincidence. If you're wondering what to do right now, start small. Get up and stretch every hour. Walk after meals. Drink enough water so your urine stays light yellow. Avoid caffeine and alcohol before bed. They irritate the bladder and worsen nighttime trips. Include tomatoes, pumpkin seeds, and green vegetables daily. And most importantly, listen to your body. When you feel the urge to urinate, don't hold it in. When you feel tightness in your hips or pelvis move, these simple actions, done consistently, are more powerful than most realize. Now, I know some of you might be thinking, but doctor, my prostate's already enlarged. Is it too late? Absolutely not. The prostate is a living tissue, and like any other organ, it can heal when you remove the stress. I've seen men in their 70s regain comfort, sleep through the night, and reduce medication just by changing habits. Your body always wants to heal, it just needs the right environment. Even if you've been sedentary for years, starting now still makes a difference. Let's visualize this. Imagine your prostate surrounded by healthy, free-flowing blood. Imagine oxygen and nutrients reaching every cell, inflammation fading, pressure easing. That's not fantasy, it's the result of circulation and movement. When you sit less, hydrate well, and reduce inflammation from diet and stress, that's exactly what happens internally. Within weeks, you start noticing subtle improvements, less urgency, stronger flow, more restful sleep. Within months, your overall vitality improves. And if you need motivation, think about what's really at stake. Your comfort, your sleep, your confidence, your independence. The prostate may be a small gland, but it plays a big role in quality of life. The late-night bathroom trips, the discomfort, the anxiety, it doesn't have to define your later years. You can take back control, starting with how you sit, how you move, and how you care for your body daily. Before we close, let me leave you with something powerful. Health isn't about avoiding disease, it's about creating balance. The prostate responds to balance. Balanced movement, balanced hydration, balanced nutrition, balanced stress. So, from today onward, promise yourself this: no more sitting for hours without movement. No more holding in urine. No more skipping water. No more ignoring your body's signals. These are the foundations of prostate health that no pill can replace. I've seen men completely transform their lives just by becoming aware of their habits. One man told me, "Doctor, I thought I needed surgery. Turns out, I just needed to stand up more." That line stuck with me because it's true. Most of our health problems are whispers from the body asking us to return to balance. The prostate is no exception. It's not your enemy, it's your messenger. It tells you when something's off. Listen, adjust, and your body rewards you with vitality. So, to every man watching this, especially those over 50, this is your reminder that small habits create big health. Don't underestimate the power of movement, hydration, and posture. Don't ignore the little changes your body's been asking for. Because when you start caring for your prostate today, you're investing in your freedom for tomorrow. And if you found this eye-opening, share it with someone who might need it. You never know whose life could be changed by one simple realization. Subscribe to Shine After 51 for more practical, science-based health insights designed for people who believe that getting older doesn't mean slowing down. It means getting smarter about how you care for your body. Because your best years aren't over there, just beginning. Asterisk.